Hair loss has many causes. 90% of hair loss is the genetic type that we see men balding. Females will get it as well. A small percentage have immune-mediated hair loss and scarring hair loss. We do a lot to try and screen those patients and treat them in other ways because they can't be candidates for this procedure. Well, FUE is the extraction of a follicle unit one by one. It involves careful aiming of the device at the unit and extracting it one by one. It's very time-consuming and tedious, but done properly, it allows for great healing and great results. Again, the other method is a giant scar, ear-to-ear incision, very, very bloody and fast. It's fast and easy, but it's just a horrible thing for the patient to go through. Versus this method is much more delicate, intricate, and overall the results are great. If you're talking about FUE and it's something you're interested in doing, you need to have at least a good amount of area in the back of your scalp to donate. It's the same criteria as the strip surgery criteria. The important things are things you shouldn't have or should try, or if you're considering, you don't want to be a patient with a lot of medical conditions. You can't really be on a blood thinner, you can't be a diabetic, you can't really have thyroid disease. Now, that's not to say that if you have these, you can't do the procedure. There are people who have these conditions and do the procedure, but your odds of success are much lower. In general, you want it to be an overall healthy person who undergoes this procedure. It is elective, it is cosmetic. The recovery time for this procedure is dramatic compared to the other procedure. The other procedure, you'd have this giant stitch that was painful and would stay in for 2 weeks. In this procedure, usually you have a Band-Aid on the back of your scalp. Band-Aid comes off in a day, maybe 2 days, and you can go back to work the next day. If you're okay with the Band-Aid, a lot of people are. They just get a Band-Aid, go to work the next day, and it's like nothing's happened. There are other ways to do this. They're not permanent. Whatever you do, you're going to do it every day versus our method is permanent. But we like to make sure the patient's informed about their options before they actually undergo this procedure. Now, once you do this procedure, you're done. There are no pills, there are no creams, there are no topical medicines, and you have your hair. You go swimming or do whatever you want with it.